Hello and welcome back. I'm Eric Sunset, your host of the DocBuddy Journal. Here at DocBuddy, of course, we deliver healthcare solutions that take the pain and cost out of broken workflows. From the ASC to the clinic to on-call at the hospital, DocBuddy helps providers access, create, and move data seamlessly, all from the point of care. You can learn more about DocBuddy and all of our solutions at docbuddy.com. Today, we've got a special guest. We're joined by Christine Munna. Christine is the Director of Quality Assurance and Staff Development at Abode Care Partners. And I should add, also a longtime DocBuddy user as well. Christine, thanks so much for joining us.
Yes, thank you for having me.
It's good to chat with you again. I know we got together just a few weeks ago to do a little bit of a different type of video. So really glad to have you on the podcast today. I know there's a few different things that we wanted to talk about that are right in your wheelhouse as that Director of Quality Assurance and Staff Development with Abode Care. But before we get into it, is there anything else the listeners should know about you?
I guess I would just add to my background. I am now our Director of Quality Assurance and Staff Development, but I started as a primary care nurse practitioner, specifically trained in geriatrics, and have worked in many different settings, but really most recently and majority of my experience in the skilled nursing setting.
Yeah, and I know it comes at you thick and fast. Abode Care is a large organization with a lot of patients to keep happy and healthy. So thanks for carving out a little bit of your time to join us today. And one of these topics that's right in your wheelhouse is around quality assurance or QAing provider documentation. Let's start by peeling that back a little bit. What are some of the keys for you, whether you're the one doing the quality assurance, you're providing instruction to your providers? What are some of the keys around optimizing provider documentation?
Yeah, so I think reasons why we really focus on the importance of this. It's very important to accurately reflect the patient's care in the medical record. Really number one, I think, reason for documentation is really conveying the chronological story of the patient and having that accurately reflected in their patient chart, the medical services that we provide. Some things that we really focus on and the importance of this. Number one, this helps us communicate with other healthcare providers. So very important to have high quality documentation for that purpose. A lot of our notes and documentation that may be shared with the patient's specialists, like their cardiologist or a pulmonologist. So always very important to keep that in mind. Relating to that as well, it helps us improve our patient care outcomes when we have better high quality documentation, very specifically as that relates to any kind of transition of care for the patient. So anytime they're moving from one kind of care setting or location to another, and they're obviously at higher risk for things kind of falling through the cracks or getting lost. So just one very important area when patients have transitions, maybe from the hospital to the skilled nursing facility or from skilled nursing facility to home. One area that we really focus in on having high quality documentation. Another might be advanced care planning for our patients, as this does communicate their healthcare wishes and needs to other providers. Very important to have good documentation when we have those goals of care discussions and advanced care planning discussions with our patients and families.
Yeah, that makes total sense. You've got a longitudinal view of the patient, at least for the amount of time that you're treating them, as opposed to something that's cut and paste and then goes off to their specialist, like you mentioned. That doesn't really help anybody.
Absolutely.
And then when you're looking at provider documentation or looking through provider documentation, I would say whether it's something that comes to you from a referring provider or something that you know that you'll be sending out, what are some of the keys for really crystal clear documentation? What do you look for?
Yeah, so we look for a lot of key areas in our documentation. I guess number one would probably be supporting the medical necessity for the patient encounter and really capturing what are the most relevant um, elements to document in the patient's HPI, like in their history of present illness. How are we describing that patient to support the medical necessity and to describe the status of whether this be a chronic condition that we're addressing or an acute issue that we may need to manage. I think one thing I really see providers kind of struggle with is what to include in their documentation when the patient doesn't really have any complaints. This is something I just spoke on this in one of our training sessions the other day. I've kind of seen in some recent reviews that providers will be like, well, I don't know what to say if my patient is feeling well. Like, what are we addressing today? So that's one kind of common area I think that providers, especially newer providers, new grads, tend to struggle with. And just kind of figuring out how do I describe this patient, in my note, and what important things should I focus on there. Um, some other areas that we tend to look at, documenting relevant areas of maybe the patient physical exam in our documentation as it relates to the presenting problem that we are evaluating and managing. I think one common kind of mistake or pitfall that we see, um, a provider might be evaluating a patient's wound, for example, and then they might forget to put their examination of the wound in their documentation. So, one big area that we look at in our reviews, and kind of providing some support and reminders on that. And lastly, I think another really big one is documenting our assessment and plans for the patient, and really focusing on the medical decision making details, and really capturing that in our documentation. A lot of times, I will see notes where we're kind of missing what our assessment is as the medical provider of the patient's problem. Is it controlled? Is it worsening? What is the status of that? What do we think of it? And then describing, what are the rationales or why, how we're making our medical decision making to treat the patient's problems. For example, are we continuing anticoagulation for this patient because it's still supported by the latest evidence-based guidelines for what we're treating for the management of that, and maybe documenting that they haven't had any adverse effects related to their medication, no bleeding episodes, that kind of thing. When we might follow up on this again and reevaluate that treatment, are all very important points I think to capture in our documentation.
Yeah, those all sound like critical points to capture for me, and certainly providers treating a large volume of patients in a given day over weeks, over months, and then over years. It certainly is just human oversight, unfortunately. But I would imagine that happens, across a bell curve. You have maybe some frequent flyers, just a career observation. There may be some frequent flyers that regularly overlook like a disposition type note, and then those that always adhere to it. What does an intervention look like? Doc, provider, PA, NP, whoever it is, you just treated this patient. I happen to be familiar with them. What's going on with this? What's the texture of that conversation like?
Yes, so in our training processes, we have a lot of kind of trainings up front when providers start with our practice, where we really focus on high quality documentation. So during like the provider's onboarding period, we every couple of weeks we have these training sessions where we do a live note review, So I'll actually pull a very recent note that's been written by one of our nurse practitioners or PAs, physicians, and we will go through that note as a small group. It's usually our new hires who are on these sessions. And we review the documentation. We talk about areas where we might could have improved that documentation, or maybe areas that were done very, very well, and that serve as a good example. So we review that, and we talk about the clinical decision making, kind of best practices, for our patients, and even look at the coding aspects of that documentation too, to do some training on billing and coding. Um, our kind of ongoing processes to provide support in that area. So even once our providers are off of their orientation and onboarding period, we have ongoing documentation reviews with our providers to provide support, kind of do some check-ins, let them know how they're doing, any areas that they might need improvement in, or even if it's just a congratulations, you're doing very well in these areas, keep up the good work. And we also have a lot of educational kind of sessions and opportunities with our team throughout the year, usually at least one a month, that they have options to join and kind of learn, as far as any kind of patient clinical areas that they may need education in, and documentation, billing, and coding as well.
Yeah, so there's obviously a lot of aspects to good documentation. Clear plan for the patient, maybe their family or their caretakers, referring providers, and then organizationally, you mentioned billing and coding. You obviously want to have the appropriate documentation to support the claim. And you said something that stood out to me is that you really want high quality documentation. And I think in some of the audience's minds, they may flash to visions of their EHR and of spending a lot of time charting. And high quality means I have to go in and out of every section of the software. Obviously, that's not so much of a concern for you using DocBuddy, but the point of invoking all of that is that really robust documentation may give people fits because they're thinking about how burned out they already are. I've just gone through my entire day treating patients. Now I have to document, or I've been documenting all along. So, how do you balance that, Christine, that need for really high quality documentation for all of the stakeholders of that visit note versus alleviating some of the symptoms of burnout where you can?
Yeah, and I think that that's a really tough one. And it's obviously just kind of trying to find a balance between the two. And that can be really challenging when you're seeing patients all day, and providing very important care. And then you get to the end of your day and you just have all of this documentation to do. I think one big area in which we have been able to streamline that, including an option of dictation, along with our EHR, and we've incorporated DocBuddy, which has been amazing. But really, just being able to dictate our documentation cuts workflows in half, if not more. So, I mean, I could spend 20 or more minutes documenting a patient note before I learned how to dictate. Um, Learning how to do it was a bit of a learning curve and kind of a mind shift. I had never done it before. So trying to incorporate that into my workflow was a little challenging at first, but once I really got the hang of it, it was worth the investment and time in learning that. So that's been one way that we've really tried to streamline things and just make it easier, on our providers. Um, some other kind of initiatives and things that we've done, with our company, and kind of speaking to burnout. We have created what we call our culture of joy, which is a committee that we have that is dedicated to really supporting our providers and our colleagues, and trying to provide some support to them and hopefully decrease, things related to burnout and just make, work life balance a little bit better and easier. One kind of initiative and thing that our Culture of Joy committee has focused on is connecting our providers to other colleagues in the company, who are success champions or kind of mentors, maybe those who have been with the company for a long time, who can help kind of provide some support and guidance. I know for me, when I started with the company, I had that mentor, kind of success champion, that I worked very closely with, and she personally helped me so much. Like, I don't know how I would have learned the ins and outs of the nursing home world, which I'd never worked in skilled nursing before. So this was all a new environment to me. So she personally helped me a lot, learning the rules and regulations in the skilled nursing facility, which can be very challenging to navigate, and how to handle that, especially as a new graduate provider. So that was very beneficial to me personally. And also, I like to encourage providers to join some kind of professional society, that they, would like to be a part of, like a nurse practitioner society, like GAPNA, or one that I'm very passionate about, PalpMed, which was previously AMDA. But I find a lot of support in that with other colleagues, and tends to, I think, help me with burnout issues. Being able to talk to other people who do the same work that we do, kind of bounce ideas off of each other, and just provide support, I think is huge for that.
Yeah, and you're hitting on, I don't know if you know it or not, I bet you do. You're hitting on what all of the surveys say are the best ways to curb burnout. So organizationally have a culture of wanting to defeat burnout. So the culture of joy and your success champions, that's really important, that the place you work for cares that you are not burning out, obviously. And then having a group to discuss it with, to be able to, like you said, bounce ideas off of each other. There's a few other sort of core drivers of burnout you see in the studies over the years. Lack of staffing is kind of the hot one in 2024. And, there's part of that ties back into culture, part of that sort of a macroeconomic or workforce issue, a little bit tougher to solve. But it sounds like you're controlling all the things that you can control, and that's huge.
Yeah, absolutely. And just one other thing I would add to that, some of like the fun things that we try to do as a company in creating, we really strive for a culture of joy, which is why we named our committee that. But trying to incorporate other like fun things for our company, which we are very spread out, so it can be hard to see each other in person, or being able to meet up with other coworkers. So we try to have like virtual team meetings, or like a virtual holiday party or something like that, to really just kind of get together with others and kind of have those fun things that we might do in person if we all worked very closely together.
Yeah, and it matters, and I can agree with that sentiment. Being at DocBuddy, we're a pretty widely distributed team. We're based in Denver. I'm in Miami, Florida, so it's kind of few and far between that you can be together. Although we are coming up on a set of team meetings where we'll have most of the group together, which is great. But it can be as small as like turn your camera on during a Zoom call. Like you don't have to just be the black square on the screen. Like let's show face, and that's the next best thing to being together in person. That's really cool. And Christine, we're kind of at the tail end of 2024 here. We're recording before the week before Thanksgiving, and that's kind of signifies basically the effective end of the year. You got a few weeks left before that break between Christmas and New Year's. What are some highlights from your 2024? What are you looking forward to in the new year? What's on the horizon for you?
Yeah, I think us personally as a company, some things that I'm very excited about. expanding into some of the new markets that we're going into and just impacting more patient lives. Expanding our business is very exciting. And one thing that we're really going to be focusing on in the following year is we are initiating the guide program with CMS. So if you're not familiar with Guide, it is a program, a new program that is being established by CMS, where we provide very comprehensive and more coordinated care for patients with dementia, aiming to really focus on their quality of life and improving that, hopefully reducing caregiver strain, and providing additional support services for patients, caregivers, patients who have dementia, helping them remain in their homes and that kind of thing. So that's something that we are really going to be focusing on in the next year. I'm going to be doing a lot of training and education with our staff on this program. So very excited to be participating in that and to get it going. We're additionally kind of expanding some of our value-based care models as well. So also pretty excited about that.
Oh, that's fantastic. That is really, really big news. And that is, the best type of care somebody in that situation could get, remaining in home for as long as practical. A little more nose to the grindstone question for you here. With a new CMS program, I would imagine there are some either different or new documentation requirements. Have you gotten all of that mapped out to be in compliance with CMS?
Yes, there will certainly be. We're kind of in the beginning stages of really rolling out how this program will work for us. I've started planning what our educational and training kind of curriculum is going to look like. So that's kind of what I'm focusing on now. But absolutely, I'm sure that there are going to be certain documentation components that we will need for this. So probably looking at creating some templates to kind of standardize that for our team. Probably using DocBuddy for that as well, creating some voice commands. So yes, we will absolutely be looking at that and planning for it.
That took a load off of my shoulders. It's really easy to throw spears at CMS. They're in a tough position. Admittedly, it's tough to make everybody happy all the time, but that is a really positive sounding program to me. So I'm excited for you. And then Christine, one of the other sort of hot topics as we look to close out this year. It's been a hot topic for the entirety of the year. I remember about this time last year, ChatGPT was really starting to catch on with sort of your off-the-shelf consumers, and of course, that's an AI-driven large language model software. The topic around AI in healthcare really hasn't ever been hotter. I don't think it's going to cool off either. It can mean a lot of different things to a lot of different people. Where do you see AI in healthcare going? Are there any use cases that you're keeping an eye on? Anything that would be meaningful to you, either in your day to day or for Abode Care?
Yeah, I think what I've seen, it just all looks very exciting. And we've been talking a lot about burnout. So I think one of the main areas that I would be most excited about is documentation support and AI generation of documentation notes. Just making that easier for our providers. I feel like documentation can be very monotonous, and that makes it very hard. So having any kind of AI support to provide some relief on that, I think that that is going to be huge, and I'm really excited to see where that goes. Additionally, clinical decision support as well. So I've heard some exciting things where AI is kind of built into EHRs where it might suggest like a potential treatment plan for a patient. For treating them for pneumonia, for example, might suggest like, hey, you should consider using this antibiotic, or consider adding this to your treatment plan. That's something I would have loved as a new grad. So I think that would be amazing, and would kind of love to see how that evolves in the future. Um, and also, one thing that I think this is probably the most exciting, but really just to see improvement in how our different systems, we all use so many different EHRs and different systems. But as time goes on, I assume that systems will be better able to communicate and talk and integrate with each other. I'm excited to see how that evolves over the next couple of years as well, because it's hard when all of our different systems are so segmented, and you go from this login to that login, or you'll never have access to that other person's EHR to be able to look up something about your patient. So I have high hopes in the future that that's something that will majorly improve.
Yeah, that interoperability piece has been a long time coming. I remember all the way back to 2009. That was the goal of EHRs for everybody, and a lot of important work has taken place, obviously, with the Commonwealth Health Alliance, and SureScripts has a national record locator service, and bringing everybody to FHIR standards. The key there, I mean, sitting on the vendor side, it's easy for me to say, not as a certified EHR, but rather as a provider workflow tool. The lack of standardized APIs across the marketplace. If you could wave a magic wand, you could have that interoperability tomorrow. And I don't think tomorrow is all that far away.
I hope not.
Well, yeah, we'll be keeping an eye on some of those same AI developments, Christine. And kind of on our way out, is there anything else to cover that maybe we glossed over?
No, I don't think I have anything else to add to that.
Well, let me ask you this then: where can listeners connect with you, or maybe with Abode Care? Any spots online, social medias, websites?
Yes, so Abode Care Partners, very active on LinkedIn and some of the other popular social media accounts. So absolutely look us up. You can follow what some of our practitioners are doing, see the care that we're providing in our homes and our communities. We would love for you to follow us.
We'll definitely get a link to the Abode Care accounts in the show notes, and I'll be keeping a close eye on updates around that guide program that hits close to home, and that'll be a really cool thing to watch out for.
Yes, absolutely.
Well, Christine, I want to say thank you again for joining us, and on behalf of the entire DocBuddy team, thank you for listening. Be sure that you're subscribed on Apple Podcasts, Spotify, and YouTube so you always get the newest episodes of the show. And until next time, I'm your host, Eric. Thanks again.
Thank you for having me.